Number 1. What immunosuppressant inhibits chemotaxis degranulation of mast cells and inhibit immunoglobulin G, immunoglobulin A, prostaglandins, and also T cell responses? A. Antihelmintic levimazole. B. Chlorambucil. C. Dapsone. D. Staphage lysate. The answer is B. Dapsone, used as an antibacterial for treating leprosy in man. It has been found to inhibit chemotaxis degranulation of mast cells and inhibit immunoglobulin G, immunoglobulin A, prostaglandins, and also T cell responses. Number 2. What is the preparation of Staphylococcus aureus and staphylococcal bacteriophage? A. Chlorambucil. B. Dapsone. C. Antihelmintic levimazole. D. Staphage lysate. The answer is D. Staphage lysate is a preparation of Staphylococcus aureus and staphylococcal bacteriophage. It is believed to stimulate T lymphocytes and activate phagocytic cells. Number 3. It is a slower-acting drug and a less toxic agent that is administered alternately with glucocorticoids. A. Staphage lysate. B. Chlorambucil. C. Antihelmintic levimazole. D. Dapsone. The answer is B. Chlorambucil is a slower acting and less toxic. It is administered alternately with glucocorticoids. Number 4. Blank reduces inflammation by inhibiting enzymes of both the lipoxygenase and cyclooxygenase pathway. A. Licorice root. B. Ginger. C. Chamomile. D. Arnica. The answer is B. Ginger is commonly used as a culinary spice, which has a stimulating and diaphoretic effect. Ginger reduces inflammation by inhibiting enzymes of both the lipoxygenase and cyclooxygenase pathway. Number 5. It is one of the most commonly used immunomodulator in veterinary practice, which is advocated at 1/3 the antihelmintic dose for immunomodulatory activity for generalized immunity enhancement and as is required post-vaccination. A. Cyclophosphamide. B. Staphage lysate. C. Antihelmintic levimazole. D. Chlorambucil. The answer is C. Antihelmintic levimazole is one of the most commonly used immunomodulator in veterinary practice, which is advocated at 1/3 the antihelmintic dose for immunomodulatory activity for generalized immunity enhancement as is required post-vaccination. Number 6. A pungent or bitter-tasting herb which helps eliminate parasites, bacteria, fungus, virus, and yeast. A. Ginger. B. Chilies. C. Garlic. D. Onion. The answer is C. Garlic is a pungent or bitter-tasting herb which helps to eliminate parasites, bacteria, fungus, virus, and yeast. It is also antiplatelet, anticholecterolemic, antiseptic, mucolytic, and also a vasodilator. Number 7. Blanc is also used for canine pemphigus and lupus erythematosus and allow for decrease in the dose of glucocorticoids. A. Dapsone. B. Staphage lysate. C. Antihelmintic levimazole. D. Chlorambucil. The answer is A. Dapsone is also The answer is A. Dapsone is also used for canine pemphigus and lupus erythematosus and allows for decrease in the dose of glucocorticoids. Number 8. Blank is an alkylating agent and is used in combination with glucocorticoids for severe cases of autoimmune diseases such as systemic lupus erythematosus, pemphigus, and rheumatoid arthritis. A. Cyclosporine. B. Chlorambucil. C. Cyclophosphamide. D. Antihelmintic levimazole. The answer is C. Cyclophosphamide is an alkylating agent which can be used in combination with glucocorticoids for severe cases of autoimmune diseases such as systemic lupus erythematosus, pemphigus, rheumatoid arthritis. The side effects include hemorrhagic cystis, fibrosis of the bladder, bone marrow suppression, and etc. Number 9. According to Swam in 1992, this herb has been shown to enhance healing in surgically induced wounds in dogs. It also may have anti-inflammatory and angiogenic properties, and it contains a glycoprotein that stimulates cell proliferation and migration. A. Aloe vera. B. Boswellia. C. Licorice. D. Turmeric. The answer is A. Aloe vera has been shown to enhance healing in surgically induced wounds in dogs. Aloe also may have anti-inflammatory and angiogenic properties, and it contains a glycoprotein that stimulates cell proliferation and migration. Number 10. Which among these has been used with some success in canine bacterial hypersensitivity? A. Cyclophosphamide. B. Antihelmintic levimazole. C. Azathioprine. D. Staphylococcal bacterine toxoid. The answer is D. Staphylococcal bacterine toxoid has been used with some success in canine bacterial hypersensitivity. Number 11. Which of these bioenhancers provide a chemopreventative effect against induced renal carcinogenesis? A. Ginger. B. Black pepper. C. Caraway. D. Pomegranate. The answer is A. Caraway provides a chemopreventative effect against induced renal carcinogenesis. Number 12. Blank blocks the proliferation of activated T lymphocytes by inhibiting interleukin 2, gene activation, and RNA transcription. It can be used for keratoconjunctivitis sicca in dogs. A. Cyclosporin. B. Azathioprine. C. Cyclophosphamide. And D. Staphage lysate. The answer is A. Cyclosporin, which is the most commonly used in man for graft rejection, may also be used in animals to prevent pemphigus, lupus, etc. It blocks the proliferation of activated T lymphocytes by inhibiting interleukin 2, gene activation, and RNA transcription. Number 13. Blank is considered to be a blood cleanser. Studies have demonstrated this herb's ability to increase secretory immunoglobulins. A. Chili pepper. B. Long pepper. C. Black pepper. D. Ginger. The answer is B. Lung pepper is considered to be a blood cancer. Studies have demonstrated this herb's ability to increase secretory immunoglobulin A. Number 14. Blank is more commonly used for pemphigus. A. Glucocorticoids. B. Azathioprine. C. Cortisone. D. Cyclophosphamide. The answer is B. Azathioprine is more commonly used for pemphigus. Number 15. Blank improves digestion and circulation. It helps to remove toxins via the colon, addresses obesity and sinus congestion. A. Black pepper. B. Yarrow. C. Calendula. D. Caraway. The answer is A. Black pepper improves digestion and circulation. It helps to remove toxins via the colon, addresses obesity, sinus congestion, hemostatic and antihelmintic agent, and is used caution in lower doses in patients with inflammatory conditions, which may cause it to aggravate. Number 16. Blank is traditionally used for cough, cold, bronchitis, sore throat, laryngitis, stomach ulcer, gastric hyperacidity, and painful urination. A. Mint. B. Gymnema. C. Cowich. D. Licorice. The answer is D. Licorice is traditionally used for cough, cold, bronchitis, sore throat, laryngitis, stomach ulcers, gastric hyperacidity, and painful urination. Number 17. What do you call a word that is also known as Indian medicine, where it's a concept derived from the use of pepper to upregulate or downregulate the immune system? A. Purusha. B. Trikatu. C. Ayurveda. And D. Prakruti. The answer is C. Ayurveda, also known as Indian medicine, a concept derived from the use of pepper to upregulate or downregulate the immune system. Number 18. What is the meaning of Trikatu? A. 3 acrid. B. 3 acids. C. 3 peppers. D. 3 herbs. The answer is B. Trikatu, meaning 3 acids. Number 19. Blank are the most commonly used immunosuppressive agents. It is used for immune-mediated skin disorders. A. Glucocorticoids. B. Corticotropin. C. Cortisol. D. Cortisone. The answer is A. Glucocorticoids are the most commonly used immunosuppressive agents. It is used for immune-mediated skin disorders. Number 20. The scientific name for ginger is A. Zingiber officinal. B. Piper longum. C. Punica granatum. And D. Piper nigrum. The answer is A. Scientific name for ginger is Zingiber officinal. Number 21. It is believed to stimulate T lymphocytes and activate phagocytic cells. A. Staphylase lysate. B. Cyclosporin. C. Glucocorticoids. D. dapsone. The answer is A. Staffage lysate is believed to stimulate T lymphocytes and activate phagocytic cells. Number 22. Scientific name for long pepper is blank. A. Piper nigrum. B. Punica granatum. C. Zinger officinal. D. Piper longum. The answer is D. Scientific name for long pepper is Piper longum. Number 23. The roots and fruits of this plant are used traditionally for diseases of the respiratory tract and as an analgesic and counter-irritant for musculoskeletal pain and inflammation. A. Turmeric. B. Licorice root. C. Long pepper. D. Ginger. The answer is C. The roots and fruits of the long peppers are used traditionally for diseases of the respiratory tract and as an analgesic and counter-irritant for musculoskeletal pain and inflammation. Number 24. What is an Ayurvedic preparation that contains black pepper, long peppers, and ginger, which are prescribed routinely for a variety of diseases as a part of a multi-drug prescription? A. Trikatu. B. Churna. C. Marichi. D. Muleti. The answer is A. Trikatu is an Ayurvedic preparation containing black pepper, long pepper, and ginger, which are prescribed routinely for a variety of diseases as a part of a multi-drug prescription. Number 25. Ayurvedic name for black pepper is blank. A. Karela. B. Hyphala. C. Tuls. D. Marichi. The answer is D. Ayurvedic name for black pepper is Marichi. Number 26. Blank is potentially nephrotoxic, hepatotoxic, toxic to alimentary canal, and bone marrow suppression. A. Chlorambucil. B. Cyclosporin. C. Staffage lysate. D. Dapsone. The answer is B. Cyclosporin is potentially nephrotoxic, hepatotoxic, toxic to alimentary canal, and bone marrow suppression. Number 27. Ayurvedic name for licorice is blank. A. Hinju. B. Muleti. C. Saum. D. Kava apikalu. The answer is B. Ayurvedic name for licorice is Muleti or Yashtimadu. Number 28. Cortisol is a naturally occurring glucocorticoid released by the adrenal gland in response to a wide variety of stressful events, including fear and other forms of physiological stress, vigorous exercise, acute trauma, surgery, or severe infection. The responses produced by cortisol can be divided into metabolic effect produced by changes in gene expression. Which of the following is a metabolic effect produced by elevated levels of this hormone? A. Hyperglycemia. B. Increased insulin sensitivity. C. Reduced muscle catabolism. D. Reduced lipolysis. The answer is A. Cortisol increases nutrient availability for the brain and vital organs in times of stress by raising blood glucose, amino acid, and triglyceride levels. Elevated blood sugar is achieved by a combination of increased glucose production by the liver and antagonizing the insulin's action to lower plasma. Increased breakdown of muscle protein provides fuel for hepatic gluconeogenesis, and increased activity for the hormone-sensitive lipase produce increased fatty acid release, which increases insulin resistance. Number 29. Which part of the bioenhancer pomegranate is used for sore throat, ulcer, colitis, conjunctivitis, and anemia? A. Bark. B. Root. C. Fruit rind. D. Fruit. The answer is D. The pomegranate's fruit rind, bark, and root contain the active medicinal principles. The fruit is used for sore throat, ulcer, colitis, conjunctivitis, and anemia. Number 30. Scientific name for black pepper is blank. A. Momordica carantina. B. Punica granatum. C. Piper nigrum. D. Piper longum. The answer is C. Scientific name for black pepper is Piper nigrum. Number 31. This bioenhancer is an expectorant and has an antiparasitic property. It is also used as a cholagogue for gallbladder disease. A. Yellow gentiana. B. Nutmeg. C. Long pepper. D. Holy basil. The answer is C. Long pepper is an expectorant and antiparasitic agent. Benefits the liver, spleen, and lymphatics. It improves circulation, digestion, and immune function. It is also used as a snuff for coma or drowsiness. It is also used as a cholagogue for gallbladder disease. Number 32. Known as a demulcent, vulnerary, and stimulant laxative. A. Poppy opium. B. Aloe vera. C. Chamomile. D. Lavender. The answer is B. Aloe vera is also a demulcent, vulnerary, and stimulant laxative. Number 33. Which among these is not an active ingredient of the long pepper? A. Piplasterol. B. Steroids. C. Piperine. D. Tannins. The answer is D. Active ingredients of the long pepper herb include piperine, piplartin, sesamin, piplasterol, pipelongumine, steroids, and glycosides. Number 34. Ayurvedic name for pomegranate is blank. A. Dedima. B. Kutkin. C. Boivali. D. Hyphala. The answer is A. Ayurvedic name for pomegranate is Dedima. Number 35. The following are the major effects of cortisol in glucocorticoids except one. A. Metabolism, electrolyte, and sodium retention. B. Increased bronchial response to bronchodilators. C. Increased vascular smooth muscle response to catecholamines. D. Increased bronchial response to bronchoconstrictors. The answer is D. The major effect of cortisol in glucocorticoids are metabolism, electrolyte and sodium retention, increased bronchial response to bronchodilators, increased vascular smooth muscle response to catecholamines, and inflammatory and immune response. Number 36. Ayurvedic name for long pepper is blank. A. Paipili, B. Boivali, C. Saum, D. Dadima. The answer is A. Ayurvedic name for long pepper is Paipili. Number 37. Scientific name for garlic is blank. A. Myristica fragrans, B. Ocimum bacillium, C. Philanthus neruri, D. Allium savitum. The answer is D. Scientific name for garlic is Allium savitum. Number 38. Blank possesses antiseptic, analgesic, and antiprotozoal activities, and its use for hepatitis and rheumatoid arthritis. A. Nutmeg, B. Fennel seed, C. Bitter melon, D. Black nightshade. The answer is D. Garden or black nightshade possesses antiseptic, analgesic, and antiprotozoal activities, and its use for hepatitis and rheumatoid arthritis. Number 39. What is the most common oral steroid used clinically? A. Cyclosporin, B. Prednisone, C. Azathioprine, D. Prednisolone. The answer is B. Prednisone is the most common oral steroid used clinically. Number 40. A type of bioenhancer that is known as an herbal prescription for osteoarthritis. A. Black pepper, B. Pomegranate, C. Licorice, D. Long pepper. The answer is C. Licorice is known as an herbal prescription for osteoarthritis and used for anti-inflammatory and absorption of herbal medicine. Number 41. Which part of the pomegranate has been found to have antihelminthic properties and activities against pinworm, roundworm, and tapeworm? A. Bark, B. Root, C. Fruit rind, D. Fruit. The answer is A. The bark of the pomegranate has been found to have antihelminthic properties and activity against pinworm, roundworms, and tapeworms. Number 42. It is an intermediate acting glucocorticoid where it's administered by IM and joint injections. A. Triamcinolone, B. Prednisone, C. Methylprednisolone, D. Prednisolone. The answer is C. Methylprednisolone is an intermediate acting glucocorticoid where it's administered by IM and joint injections. Number 43. It is an intermediate acting glucocorticoid with high affinity for cytoplasmic receptors, and by binding, it inhibits protein synthesis. A. Triamcinolone, B. Prednisone, C. Methylprednisolone, D. Prednisolone. The answer is letter D. Prednisolone has high affinity for cytoplasmic receptors, and by binding, it inhibits protein synthesis. Number 44. It is a long-acting glucocorticoids that is potent, indicates cerebral edema, and is administered orally or parenterally. A. Betamethasone, B. Triamcinolone, C. Dexamethasone, D. Prednisone. The answer is C. Dexamethasone is a long-acting glucocorticoid that is potent, indicates cerebral edema, and is administered orally or parenterally. Number 45. Which among these is an effect of glucocorticoids in leukocyte kinetics? A. Neutrophilia, B. Hydrocortisone, C. Eosinophilia, D. Erythrophilia. The answer is A. There is an increased levels of neutrophils, and there has been demargination and release from the bone marrow. However, monocytopenia, lymphocytopenia, eosinopenia, and basophilopenia is likely the effect of glucocorticoids in the blood. These four are not destroyed but redistributed out of circulation. Number 46. Blank is a glucocorticoid medication that is mostly used to suppress the immune system and decrease inflammations in asthma, COPD, and rheumatologic diseases. A. Cortisone, B. Budesonide, C. Triamcinolone, D. Prednisolone. The answer is D. Prednisolone is a glucocorticoid medication mostly used to suppress the immune system and decrease inflammation in conditions such as asthma, COPD, and rheumatologic diseases. Number 47. What is the scientific name for pomegranate? A. Rubus species, B. Punica granatum, C. Polygonum bistorta, D. Paullinia cupana. The answer is B. Scientific name for pomegranate is Punica granatum. Number 48. It is a bioenhancer that is known to be hepatoprotective, anti-ulcer, and anti-inflammatory activity. A. Belladonna, B. Mint, C. Garden nightshade, D. Sweet basil. The answer is C. Garden or black nightshade is known to be hepatoprotective, anti-ulcer, and anti-inflammatory activity. Number 49. Which among these can be used for keratoconjunctivitis sicca in dogs? A. Cyclosporin, B. Prednisone, C. Azathioprine, D. Prednisolone. The answer is A. Cyclosporin and tacrolimus can be used for keratoconjunctivitis sicca in dogs, for it is an ophthalmic medication that stimulates tear production. Number 50. It is an intermediate-acting glucocorticoid that requires metabolism. A. Methylprednisolone, B. Triamcinolone, C. Prednisolone, D. Prednisone. The answer is D. Prednisone is an intermediate-acting glucocorticoid that requires metabolism in the liver to its activated form.